Knowing your own body and how you feel on a day-to-day basis is crucial to living well with COPD, and especially important in spotting and managing flare-ups of the disease, often referred to by doctors as exacerbations. Exacerbations can also be described as lung attacks. An exacerbation is a worsening of your symptoms and will make you feel generally unwell. If it's left untreated, an exacerbation can have a serious effect on your health.
Every time you have an exacerbation, you're going to get a little bit worse. And so it knocks you off a little bit. You know, it can last for weeks as well. So you can be off your feet, you'll get a bit weaker, your exercise tolerance will be reduced. And, you know, it can be hard to get back to where you were before that exacerbation. In the really worst case scenario, you can end up in hospital, but that doesn't happen to most people. Most people don't end up in hospital. For most of you, you can manage exacerbations with some antibiotics and a short course of steroids from the doctor. But it's really, really important that you get your antibiotics and your steroids quickly. And it's really, really important that you actually treat these exacerbations early. And we do know that if people treat them earlier, then they actually aren't so severe, they don't last so long, and also that you have less exacerbations if you treat them early and promptly.
Treating exacerbations promptly, rather than waiting to see if they get worse, is extremely important and will significantly improve your speed of recovery. But how do you spot when one is coming?
It usually starts with a bit of a cough. I cough anyway, but more of a cough. I've got less energy than normal. I feel generally unwell.
One thing is you tend to get more tired than what you would normally, which not immediately you'd necessarily notice.
First of all, I feel grotty and breathless. And then I start to cough. Now, I don't normally cough, but when I start to cough, I start bringing up phlegm, and it's usually just white, ordinary stuff. But when I get an infection, it starts to change colour.
Some signs of a flare-up can be difficult to recognise if you're already feeling generally tired and breathless. However, there are some key indicators to look out for that will only happen with an infectious exacerbation.
So if your sputum is normally number 2 colour.
If there is a change in the volume or colour of your normal mucus or phlegm, ask your nurse or doctor about phlegm charts to help you recognise what the changes are for you.
If you are somebody who has a lot of exacerbations, by a lot I mean more than a couple a year, then you probably actually want something that we call a rescue pack at home. So that would be like a short course of steroids and a week's course of antibiotics that you could take if you're getting a chest infection, if you're getting an exacerbation.
The impact of treating it quickly is it hits the infection quicker and you get over it quicker, because you haven't got the 3 days for no treatment at all. But you're treating it, I might wake up in the morning and think, oh, I've got one. I can tell I've got one, I'll take it now.
Although I still go and see the doctor, or I'll contact the COPD team and tell them what I've done, it's important to take the antibiotics at the first sign, because it gives you an early start in fighting the infection that you've got.
The key to managing exacerbations effectively is to spot them early. Keep an eye out for how you feel daily and take note of any change in how tired you are or if you feel unwell. A very good indicator of an infection is a change in the colour of your sputum or phlegm, so make sure you watch out for this. Talk to your doctor about having a rescue pack of steroids and antibiotics at home. It can be very useful to have the medications to treat a flare-up with you for when you need them. Although most exacerbations are caused by infection, not all are, and some may not require antibiotics. Treating an exacerbation promptly, rather than waiting to see if you feel better, means you're much more likely to make a quick recovery. It's quite common for people to mistake the symptoms of a panic attack for the start of an infection. When you're panicking, you can feel like you're struggling to breathe and that you're unwell. The key difference is that an infection will come on gradually over hours or days, whilst a panic attack is an instant change. If you suddenly find yourself struggling to breathe, it's a good idea to think if there's anything happening that might be causing you to panic.
It's really about looking at the triggers. You know, you're asking yourself, am I actually having a panic attack because I've got so much stress, because I'm very frightened about what's going on? Or is this actually a chest infection.
The longer you have the disease, the easier it is for you to tell yourself what it is, you know, whether it's a panic attack or an infection.
With an exacerbation, there will be some other symptoms. You will have a change in your phlegm. It won't be just your breathlessness. You might have sore throat. You might have a temperature. So with an exacerbation, there'll be some other physical symptoms that are going on.
Understanding the difference between a flare-up and a panic attack can be helped by monitoring how you feel. Spotting a change in your condition is much easier if you keep a record. Lots of people with COPD find it helpful to keep a diary of how they feel daily to help detect any changes in their health.
I decided then to start a diary. I actually call it my Feel Well diary. If I'm having a good day, I'll say, yep, feeling well, you know, managing well, everything fine. Even if I feel a bit off, not feeling myself today, got a bit of a fuzzy head, I'll even put that in. Because then tomorrow I might just be back to normal, because it's easy to forget. These tools all help me manage my own illness.
The British Lung Foundation has produced a self-management pack to support self-management. This is only available from your nurse or GP, so you'll need to ask them to order it for you. Panic attacks can sometimes be mistaken for exacerbations. The longer you have COPD, the easier you'll find it to spot the difference. But a good general rule is that an exacerbation will have some physical symptoms that go with it, such as a change in sputum colour, a sore throat, or more coughing than usual. Always check for your physical signs before taking any medications. Keeping a diary of your condition on a daily basis is a good way to monitor your health and check for any changes. The British Lung Foundation can provide you with a health diary as part of your self-management plan. Ask your doctor for more details. Chronic obstructive pulmonary disease is a condition that affects your daily life in many ways. But as we've seen, with careful planning and some changes to your lifestyle, it's possible to continue to live a full and active life. You will have to do some things differently, but if you learn how to self-manage your COPD effectively, you can continue to be active, enjoy quality time with your family and friends, and do many of your favourite things. You don't have to do it alone. The British Lung Foundation can help with everything, from quitting smoking to your local exercise class. But your greatest asset is yourself. By taking control of your condition and giving yourself the tools and the knowledge you need, you'll be ready to live well with COPD.